Broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining our webinar, COVID-19 in the Now Normal, Vaccines, Variants, and Virus Infection Rates. This webinar will be hosted by Travis Wilkes. I'm Amy Knock, and I'll be moderating the webinar today. Before we begin, I just wanted to let you know a little bit more about how the webinar and how it will work. The webinar is being recorded, and the slides and recording will be available for you within 3 business days. A short Q&A session will follow the presentation to answer any viewer-submitted questions. During the webinar, you can submit questions you have using the webinar sidebar menu. Select the Questions tab, type in your question, then hit the Enter key on your keyboard. Remember, you can submit questions throughout the webinar. And at this point, I will turn it over to you, Travis. Thank you.
Hi, thank you. This is, so I am Dr. Travis Wilkes. I am the medical director at empowerDX and Eurofins Safer at Work. So hopefully everyone is very excited to hear more about COVID, the favorite topic for the last little bit over a year now. But hopefully this is a more optimistic presentation. So I am excited about that. So COVID-19 in the now normal. So we can jump in a little bit after some of this stuff. So this is a little bit about how to submit questions at the end. This program is relatively easy to use. So this is me. I basically, my life since March of last year has been consumed by COVID-19. So I spend most of the time, including free time, time at the park with my kids, looking on my phone about things about COVID. So this is pretty much COVID is consuming my life since March of last year. So hopefully this presentation will be a way that we ultimately get to the end of the pandemic and find a way forward into the now normal. So first, we have to start with a little bit of, I guess, negativity. So no herd immunity. So there is sort of this moving consensus that we are not going to be able to get to herd immunity anytime soon, if ever. So there was a lot of optimism about herd immunity when I guess now maybe a year ago, you know, if we could get vaccines, we could get to a herd immunity situation. What unfortunately has happened is that we've had a lot of variants develop since then, and variants are creating difficulty in putting together, you know, an actual plan for herd immunity. Along with that, we have to deal with a lot of different personalities and people who are sort of anti-vaccination, and the vaccination rates are not climbing as high as we would want, and then that allows for more variants to develop, and basically we're sort of at the mercy of all these different forces. So what can we do now? So the goal is to try to develop COVID-free spaces. And this is possible. I mean, we can. COVID has dropped in prevalence enough to where we should definitely be able to create environments or spaces where COVID doesn't exist, and we sort of ensure that with safety nets, or at least we strive to. So that's going to be a big focus of what we talk about today. A big thing is going to be how do we kind of allow for science to have time to develop ways to fight variants, to deepen our understanding of how vaccines work for COVID, and how we get lasting immunity, and how do we also take a sort of a proactive approach to mitigating risk. So we don't really know how long the vaccines are going to be effective. There's a lot of speculation, but there's new papers that get published every day. We sort of have to take a view of let's watch this and see what happens. Then we also don't know what's going to ultimately happen with vaccination rates either. I mean, in a perfect world, we would reach 100% vaccination rate. So far, in the United States, we're less than 50% despite the abundant availability of vaccines. And there's a lot of disparities between states. Some states have significantly higher percentages than others. And so that becomes something, all of these become sort of challenges that increase risk of COVID developing more variants and increasing the risk of spread and ultimately extending this long gauntlet that we've all been stuck in for a while now. So variants of concern. So this has been interesting because I think that everyone's gotten kind of confused by sort of the naming changes. So we went away from a naming nomenclature that was very much based on location and naming things after places like UK variant and India variant to using a Greek alphabet system, which is really a better system. So what everybody's hearing about now is the Delta strain. So the Delta strain is the strain that appears to have developed out of India, sometimes called the triple variant. It's had several different names, but Delta has become what we are officially calling it. And what the Delta really showed is that variants can become more transmissible, potentially more lethal, and really wreak havoc on public health. And we also know that viruses constantly change through mutations. And so there's around 4,000 variants that we're aware of. And every day, there's the opportunity for more variants to develop. And it's very hard to predict when a dominant variant will develop. The Delta variant is largely becoming the dominant variant in many places around the world. If you look at the United States, we are seeing a huge rise in the Delta variant. The Delta variant has risen from about 6% prevalence of positive COVID cases last week to 10% this week. So a pretty rapid increase. And part of that's probably driven by the fact that the Delta variant seems to be about 60% more contagious than the Alpha variant, which is what was previously called the UK variant. And so, it's very, very important that we stay on top of variants and that we're aware of them, that we're aware of the changes. The Delta variant has also brought some changes in symptoms, which have probably led to people not recognizing that they had COVID because they didn't have the classic symptoms of COVID. And all of this to me just represents more uncertainty, as well as current vaccines appear to not work quite as well. The mRNA vaccines seem to have an efficacy of about 88% against the Delta variant versus significantly higher rates against other variants. So all of this stuff is sort of important to consider when you're trying to figure out how to approach the now normal. So one way to approach it is to sort of take this testing for negative approach, which is you want to ensure negativity. So you want to sort of make the assumption that a community, location, event, whatever is COVID free. And you may feel comfortable doing that based on prevalence rates and based on vaccination rates and based on these numbers that they can look really good, but then we can't always predict how well the vaccine is going to work, what is the predominant variant in that area, other things kind of come into play. And so then if you take the approach of we're going to test for negative and ensure negativity, then your goal becomes, let's make sure that our location is COVID free. And testing really allows you to do that. And there's a lot of different ways to test. One of the amazing things that's happened over the last year is that we've developed so many different approaches to testing. So it doesn't have to be everyone get a nasal swab. It may be more appropriate to use environmental testing in certain situations, like wastewater testing, or air testing, or surface testing. In other situations, we may be better off using pooled testing, where you can actually much more cost effectively test a lot of people at one time by pooling the test together with the assumption that they're negative, and hopefully that entire pool of people will be negative. So there's a lot of different ways to kind of approach this, but if you take the approach of ensuring negativity, you're kind of taking the same approach to like blood donation. So, you know, if you donate blood, there's sort of an assumption that you don't have disease. But the blood still has to be tested to ensure that it is negative of any diseases and can be then given to someone else safely. So this, I think, is a really important concept to consider, and we'll kind of explore that a little bit more. So really, the better, I think the most important thing is that you have a plan. So you have to look at a situation and say, how do we plan to maintain or ensure negativity in this environment? And that may be important to take into account local positivity rates. It may be important to take into account local vaccination rates, local variant predominance, but it may also be important to take into account, like, what kind of location is it? Is it indoor, outdoor? How many days is it? There's all these different kind of things that go into play in work environments. It creates certain things of, you know, how do you make sure that someone who's coming back to an office where they're going to interact with people all day, and especially with the assumption that most people will not be wearing masks, how do you ensure and make people feel comfortable that that negative status is really there, especially when you know, the last thing someone wants is to get sick, but people also don't want to take something home to a loved one who may have not as robust of an immune system. So there's other things important too, kind of from a business perspective. So you get into liability protection, brand protection. You know, nobody wants to be the epicenter of an outbreak. And one thing that's clear, especially with some of the herd immunity research and all, is that there will be localized outbreaks. And so localized outbreaks are probably going to become the more likely norm compared to widespread outbreaks. So it's probably very unlikely that you'll have a citywide or statewide outbreak at this time, but localized outbreaks will be more common, as will kind of hyper local outbreaks of very small communities or centers where variants will outbreak, and there'll be a lot of COVID positivity and illness. So, you know, as it says there, nobody wants to be associated with an epicenter of an outbreak. It's also really important that people have trust when they go to work, that everything's being done to keep them safe. And I think it's also important, sort of as a employer branding for recruitment too, that the places are safe environments. You know, safety has kind of changed a lot over the past year. I mean, more than a year ago, safety may have meant something more like you know, being protected from other things other than just disease, gun violence, and these kind of things. And now safety still includes those, but now extends into health more than it used to. So how can we sort of think about this? So a very common thing is that many businesses are sort of set up with this idea of risk management and trying to prevent injuries and trying to prevent any kind of safety incident. And that's really important. And really the idea is that most accidents are avoidable. And if you take the time and effort to work out a plan, you can create methods that ensure safety and reduce injury. So it's the same idea here. So I would say, you know, let's say a year ago, 9 months ago, even 6 months ago, the biggest deal was, okay, we've got to find everyone who's positive, and we have to isolate them. And anyone who's been exposed, we need to quarantine them. And it was all about sort of finding these positives. And so now it's more about, we can avoid the outbreaks, we can avoid the spread, and we can avoid being an epicenter, and we can make the assumption that we're negative, and then ensure that negativity. And so I think the best thing would be if it would be an amazing accomplishment for a business to be able to present, you know, we've had 100 days of no COVID, or 50 days of no COVID cases. I mean, that's an amazing feat to be able to say, especially compared to where we were a very short period of time ago. I especially like the third example on here because it gets into IT malfunction, and I'm sure everybody on here probably has to deal with IT issues, and IT departments always talk about 99.9% or 99.8% uptime, even though that 0.1% seems like a long time. They still do a really good job at sort of maintaining these high operational states, and so we are trying to do the same thing from a health standpoint and kind of mimic that. So we can get into some questions a little bit, and then we can open it up to some questions, because other people's questions are probably equally as interesting. So what's your recommended frequency of individual PCR or other testing in the workplace or community? So I don't think that there's a standardized approach to this answer. It's a common question, but it really needs to be sort of individualized. Different environments are going to require different things, and I think it's really important that companies sort of take a value-based approach to it and say, okay, what do we need? What is our environment? What is our employee population? How much immunity do we have within our population, or vaccination rate do we have in our population? And how do we use all that data to come up with the best plan, which may include sentinel testing of environmental things. It may include pooled testing, which can significantly cut costs. But I really think that there needs to be some plan in place to sort of monitor asymptomatic people to some degree, and really ensure the negativity. So the next question is quite similar. So what factors should I consider when setting up a testing protocol? So kind of all the things that I just mentioned. So location, local prevalence, local vaccination rates, number of employees, employee mix, sort of how essential employees are. It may be, every business is sort of set up differently. And really taking all those things into account, as well as sort of environmental things. So do people all eat in the same room? Do people work really closely? Is there a lot of close interaction? Really understanding and dialing into these things helps you really set up a successful program that's value-based and sort of maximizes efficiency with sort of being minimally disruptive. Because I know everyone is sort of has been disrupted enough throughout all of COVID. So whatever we can do to help minimize that disruption, I think is really important. So given the variation between exposure and onset of symptoms, do you have any recommendations on increased monitoring or intensified monitoring? Is it necessary? So one thing that's really important is that that I think that you need to establish an interval that you're comfortable with based on risk analysis of how frequently to test, and it needs to be sort of on a schedule. So you don't want to you don't want to go in and just test randomly. So you don't want to do it some sort of testing today and then maybe in 5 weeks or maybe in 8 weeks you test again. I think you need to sort of establish a really good scheduled protocol that that maximizes the efficiency of it. So maybe and there's ways to blend human testing along with environmental testing to sort of maximize that benefit and catch a possible exposure. But symptoms are really tough because onset of symptoms can be several days, or some people won't have symptoms at all. And also, interestingly, symptoms are changing dramatically. So there's been a massive change, especially in people under 40, with the new variants that show that sore throat and runny nose and fever can be predominant symptoms as opposed to the previous symptoms that we sort of became so sort of honed in on looking out for. So that all makes a big difference. And so intensified monitoring, I think you need to take things into account for that too. So what is vaccination rates and what does your environment look like? So just having a really good sort of analysis of your unique environment will help best develop a monitoring program at the intensity you need that's actually value-based. So what do you recommend in place to ensure a tight testing system, thereby eliminating the need to increase monitoring due to outbreaks? So I really think that has to do with the scheduled nature. I think you need to be aware of local prevalence and local changes, because if there is a local outbreak, you may want to change your protocol or sort of have in your protocol a method at which if local rates climb to a certain number, then it becomes more intensified monitoring. And maybe if it reaches some number, then you do individual testing, or you sort of increase the overall monitoring. So a lot of these questions are tough because they need to be individualized, and they really need to be had on a one-on-one discussion rather than sort of generalizations. But I'm hoping I can try to sort of open the door to some things, and then ultimately though, these things need to be considered at a personalized level is, I think, the best way to think about it. So to manage costs, is there a recommended methodology for determining the most lean and efficient sampling system? I don't think that there's a standardized methodology, but I think that there is definitely an easy way to sort of lean on a lot of the technology that's developed, including pooling and including environmental testing, as well as sort of possibly strategic testing. I've spent a lot of time developing strategic testing for events and ways that sort of minimize disruption or maximize participation. A lot of what it has to do with is, what is your goal? And so if you understand your goal, and then you understand what the costs are, then you can sort of develop an efficient system that's really highly valuable, and make sure that you're ensuring negativity, but also creating that safety net to where you're catching positive cases if they do develop. And then in the event of an outbreak, what should I consider for testing? So outbreaks are an entirely different animal. So everything we've talked about has sort of made the assumption that that you are not in an outbreak. And so when we're testing for negativity is a very different thing than testing in an outbreak. It's sort of the same thing as in safety. You know, with preventing an injury when there hasn't been an injury in 200 days is very different from preventing an injury when things are falling from the ceiling and you know, there's an earthquake. So in the event of an outbreak, you definitely need to have a very well-defined plan on what you're going to do. So understanding how to observe local trend data, understanding how to pick up on outbreaks early on in the local area, and then responding to those by having a really robust testing protocol. And that may include individual PCR testing, that may include individual antigen testing. A lot of times in the setting of an outbreak, antigen testing may be extremely useful because it's so fast because you get the result back in a few minutes. And so what I think is most important is that if you try to coordinate a protocol in the midst of an outbreak, it's going to be really, really difficult. You really have to have that sort of emergency plan in place beforehand, and how things are going to roll out, and who's going to do the testing, and how quickly it's going to be done, and what do you do with different outcomes of testing, and how's the business going to move forward, and you know, all these things have to be sort of thought out. And if you have a good plan for thinking them out, you can really turn what sounds like a complete disaster of an outbreak into a pretty well organized situation where disruption is really minimized. I mean, if there's an outbreak, there's definitely going to be disruption, but a well-oiled machine approach to it is really going to minimize that disruption, and hopefully then minimize costs, you know, in terms of business loss and all those things. So what month, how long from now would you recommend reevaluating the recommendations being made in today's presentation? So things are changing every single day. So this is a really hard question. I think that that things need to be reevaluated sort of continuously. There needs to be ongoing dialogue as new things come out, so that way you're using the best possible evidence-based approaches to providing safety. You know, in terms of what does that look like realistically, that may be, you know, meeting about changes every 2 weeks, or you know, trying to understand how things are moving and what's developing every 2 weeks or so. That's probably how I would think about that. As we look forward towards what we hope will be a step-down environment with ever fewer cases, what will your next recommendations be likely to look like? Perhaps fear of this, less frequent, eliminating this or this other thing. That's really tough. You know, the goal will be that COVID goes away. I mean, that's the dream. And you know, will that ever happen? I don't know. I mean, there's some kind of forward-looking statements that have been made that it may take 5 years to get under control, but we don't really know. I mean, just saying how much stuff has changed in the last year is really hard. I think that no matter how few cases, until we really get COVID just eradicated, there needs to be a vigilance that's sort of energy spent and vigilance spent towards keeping COVID cases minimal. So otherwise, all it takes is one variant to pop up. I mean, COVID was once a very isolated illness, and now it's global. So all it takes is for small changes to really lead to really big global problems. So I would say that my recommendations are likely not going to change anytime in the near future, largely because we really need to ensure the negativity. And until we're sure of complete eradication, some measure to ensure that negativity is important. Now, I think that taking the very individual approach is really important, because it may be that we move to where human testing is not really needed anymore, and we can move to an environmental testing approach and only test environmental stuff, which I think would be great. I don't think we're there yet, but it could be that as vaccination rates climb and maybe new vaccines come out that are even better, that we inch towards that. But I think at least environmental testing is probably going to be necessary for a while, as well as some degree of human testing. But I would hope to be proven wrong, and that COVID gets completely eradicated, and we only talk about it in terms of history. So most of my employees will remain remote, or only come in once or twice a week. Why would I need testing? So there's different ways to approach that. So, your workforce is still your workforce. And so you still want them to be healthy, regardless of if they're coming to one physical site or whether they're remote. That may completely change how you test. And so, some companies have people who travel constantly, and that needs to have a different protocol perhaps than a place where people all work together in one building and don't leave. But still, I think having some way to ensure the negativity is important, regardless of, are they hybrid workers where they work in the office and work at home, because you don't want anything being brought into the office. And there may be ways to then institute more pooled testing, environmental testing on a different schedule that really doesn't cause much disruption, but really helps you make it where people feel safe when they do come into the office. Because the last thing you want is for someone who works at home 80-90% of the time to be scared when they come to the office. So that's really important, and that gets to the point of why we want to ensure negativity and test for negative. So if you have been fully vaccinated, can you still get COVID? And the answer to that is yes. If you do get COVID and you've been fully vaccinated, you are much less likely to be hospitalized with current strains, but you definitely can still get COVID. Now, that is not a slight against the vaccines. I think the vaccines are amazing. I fully support vaccination. I myself am fully vaccinated. However, you definitely have to understand that the vaccine is not 100% effective, and as we've seen with the Delta variant, the variations can decrease that immunity. And so the short answer is yes. If I have COVID symptoms, should I get tested even if I have been vaccinated? And the answer there is also yes, for the same reason, because you can get COVID. And so even though you are very unlikely that you'll get very sick and end up in the hospital, you could still be a vector and spread COVID, which would be absolutely terrible to then give COVID to someone else. And this becomes a big deal now when we live in a country where the vaccination rate is still under 50%, because then basically every other person is unvaccinated, and so every other person could very easily get COVID, if exposed. Is contact tracing still occurring for those who test positive? I think it largely depends on local public health authorities who have largely managed contact tracing. Contact tracing has always been a really big challenge, largely just from a staffing situation for a lot of local health authorities. But for many places, contact tracing is still happening. If I test positive, do I need to quarantine, and for how long, even if I have been vaccinated? So even if you, again, you can get COVID even if you've been vaccinated, and I'm aware of several cases where people have gotten COVID after vaccination, typically minimally symptomatic, but still they tested positive, and several had symptoms. So yes, you do need to isolate. There's a little bit of a difference between isolation and quarantine. So isolation, if you test positive, CDC guidelines are to isolate. If you are exposed and you're unvaccinated, CDC guidelines are to quarantine. But absolutely, you still need to follow CDC isolation guidelines if you test positive. So that would be 10 days by current guidelines. So Eurofins provide support and partnerships. So Eurofins testing strategies are designed to anticipate real-world daily lives and protect us all from potential virus transmission in current and ongoing conditions. Eurofins offers solutions tailored to fit individual, organizational, and governmental needs. Eurofins has been on the front lines in the fight against the global COVID-19 pandemic since day one. We performed more than 24 million COVID-19 PCR tests between March 2020 and May 2021. I guess that's a little over 400 days, but it seems like much more than that. So new innovations. Largely, the newest innovation we're seeing is antibody testing in terms of the testing world. So there's some phenomenal stuff being done in the pharmaceutical world with continued vaccine development, many new vaccines in the pipelines, and ways to improve vaccines and booster shots. It's all very incredible. But in terms of human testing, that's not symptomatic, because we've seen a lot of innovation in testing for diagnostic testing, for symptomatic and asymptomatic people to recognize those infected. Antibody testing is basically a way to look and see if you have immunity, and immunity can come both from having had COVID and also from vaccination. We still don't know exactly how long vaccinations will last. So are you protected from COVID for 6 months or 9 months or a year after vaccination? Do the different vaccines have different efficacy, longevities? We just don't know about this stuff. One thing that's definitely been recognized is that if you get COVID, you generally stimulate an antibody response, and if you get vaccinated, you also stimulate an antibody response. Well, what we don't know is how long does it take to lose those antibodies, and what rate do they decline, and then what number of antibodies is good. So how many antibodies do you have to be immune? We just don't know that right now. Antibody testing can be used to assess populations, though, and that can be really, really helpful, because the better data you have, then the more you can understand your workforce, and then that makes it easier to kind of make decisions about other testing protocols, individual testing and environmental testing. So in terms of understanding how much adaptive immunity there is within your population as a population health tool, it is extremely useful to sort of follow and understand that. At an individual level, we're still waiting for research to come out. There's a lot of active research being carried out right now. And there's a lot of eagerness and optimism on how we can use that to better understand how to provide booster shots, who to provide them to, who has the most protection. There's a lot of questions here that will probably be answered in the next few months, and I'm really optimistic about how this space is going to develop. So you can see we have lots of ways to try to look at safety. So from human testing or people testing to early detection using environmental sources to support with certifications, process audits, and training. Really, innovation is everything. And so here is, if you want to put in some questions, feel free to do that now. And then this is Karen's email and contact information. If there's any questions that pop up, please send her the emails, and we will make sure we get answers to those questions.
All right, thank you for your presentation, Travis. I'm going to go ahead and just put up the poll here, launch that, again, asking if anyone would like a Eurofins representative to contact them. So it looks like we have several questions that have come in. So Travis, the first question is, can you discuss the difference between pandemic theater and actions that are worthwhile to take?
Yeah, definitely. I have a lot of opinions on on that. So so things that I think that you need to take true safety, a true safety approach. So every test you do has to have a rationale and a reason behind it, and a plan for what you're going to do, positive or negative. What I think is more the theatrical side of things is largely what we've seen done with things like temperature checks, which I think make people feel like a lot's being done, but are really not the most useful, especially when they're so easily sort of countered by over-the-counter medication like Tylenol and ibuprofen, and also so many people have no symptoms. So I would say that the line in the sand is create a plan that fits your organization, your event, whatever you're trying to protect. Have a plan at which what you're going to do if there is positive cases, how you're going to be really happy and celebrate when they're negative, and just have that protocol standing by.
Thank you for that response. And then we have one more question that did come in, also asking, what's your opinion on clear plastic face shields when worn without masks? Do they offer any value?
So I think that they definitely offer eye protection to a degree. I do not think that, so let's back up for a second. So it depends on what you're talking about with masks. So when we talk about mask wearing, a conventional mask is worn to protect other people from you. A plastic face shield is a personal protective device, so it is to protect you from other people. And so it may help, especially in terms of prevent the virus from being able to enter your eyes if it's circulating. It's probably not going to help so much on the air side, but the eye protection is real. But I do not think that it provides adequate protection to other people from you. So if you're, if someone's unvaccinated and they really should be wearing a mask, I do not think that the clear plastic shield is an appropriate level of protection to the rest of the population.
Great, thank you. And then in addition to testing, what safety measures do you recommend vaccinated individuals take to be proactive in the workforce and also in social settings?
Yeah, so I think, this is really hard because everybody wants to get back to normal. I mean, everybody wants to hug their friends and sit with people and sort of live a natural life. And so I think that's one reason why I lean a lot on testing, because I want to do those things. I think everybody wants to do these things. I think that taking sort of a heightened sense of what's sanitary is good. I mean, I think that, don't share food, don't share drinks, hand sanitize frequently. I think that all these things are definitely important. But I think people will be human, and they will want to interact with people, and especially when they're vaccinated, they're going to want to have some freedom. And so I think that that's inevitable. I think that just taking sort of standard precautions is good. Like I said, hand sanitizing, hand washing, all those things. And it's been really interesting because since COVID, there's been sort of a massive, well, not since COVID, but since the demasking, I guess, there's been sort of a massive rise of what I call kind of regular cold illnesses as a result of that. So clearly things are still spreading actually more person to person with the rise of those, and due to increased interaction between people. So I would say take standard precautions that are good, and then the testing protocol is that ensuring negativity and sort of safety net that should help people feel comfortable doing those things.
Okay, wonderful. And I'm just watching here, and it doesn't look like we have any additional questions. So I would say at this time, we can go ahead and wrap up this session. I want to thank you, Travis, for your presentation. And again, I want to remind everyone that a recording of this webinar will be available within 3 business days, along with a copy of the slides. So thank you again, everyone, for attending, and I hope you have a great afternoon and evening.
Thanks.
Thank you.